Hi, I'm Anthony Coxon, President of the Australian Chiropractors Association, and welcome to my May President's Message. Of course, May is an important month for chiropractors. It's Spinal Health Week, so hopefully you've engaged with this program. If you haven't already, please go on to the ACA website, have a look at the Spinal Health Week video to show you a little bit more information about the background and why we've gone in the direction with Consider a Chiro and the internal and external messaging, and of course the best way to implement this in your practice. There's a lot of information there for you. It's high quality materials and we really want to get the ACA branding out there into the public. Now, last month I attended the Southern Regional Committee meeting, and of course from the moment of nationalising of the ACA, the board made a commitment to stay connected with our regional centres. And the way we keep that grassroots footprint and connection to the profession often happens through these regional committees. 2020 was a very difficult year in that most of the programs that these regional committees had planned to roll out for members, of course, needed to be cancelled. 2021, things are looking more optimistic, and we're certainly looking forward to many seminars and events to roll out for all chiropractors across the country. Please get involved with them. I'm sure you'll enjoy engaging with your fellow colleagues, especially after the difficulties and I guess loneliness of 2020. So of course, one of the signs of a really dynamic and healthy association is when members are actively engaged. Constantly I'm getting messages from members bringing us up to date about events. For example, recently a Sydney member rang into the association to let us know about an ABC program that he just listened to. That was fantastic because we were able to respond with that on the same day and really make sure that the chiropractic content was being represented in the best possible light, and also to help develop future relationships so that when these matters are considered, the media will be thinking about chiropractic. Often I respond to emails personally, or as do other members. Of course, it's really important that we understand that as registered health professionals, we always do all our communication, whether it's into the ACA or out into the broader community, in a professional and respectful way. And I'm happy to say that's almost always the case with the chiropractic profession. Like all professions, we have our exceptions, but please be always aware and mindful of what your communication is representing. Importantly, along with this, is to understand how the ACA board versus staff work. Essentially, the CEO is an employee of the board. The board instructs the CEO on strategic planning, and then it's his job to implement that, in this case Matthew Fisher of course, to implement that through the staff. So if you have concerns about the strategic plan, certainly bring it to the attention of the board. We're always interested to talk to you, and quite often it's just a matter of sharing information to ease people's concerns. But of course, sometimes we all have differences, like we do in all professions. So other things coming up for the profession, we have the Pediatric Consensus Guidelines. The first meeting of the steering committee happens in the month of May. We also have the unfolding of the IT platform. This is a big investment financially for the ACA and will help improve your interaction with the ACA and your user experience. And this is something that will be rolling out over the next few months. And of course, next month in June is Renewal Month. So if you pay your fees annually, that's when your fees will be due. On behalf of the board, I'd like to say thank you for your contributions and for your membership. We really appreciate it, and I think we're going in very positive places with your support. So thank you again, and I look forward to chatting with you on my next President's Message.